When a new precious life enters this world, healthcare providers do all that they can to provide care and comfort to the baby and new parents. Physical examinations of the baby are performed to look for signs of illness or distress. Blood tests are ordered to look for underlying conditions. The Newborn Bloodspot Screen is one of these tests. Performed at 24 Hours of Life, Newborn Bloodspot Screening is an opportunity to identify serious but treatable health conditions very early in life that would otherwise not be detected. Every day, physicians, midwives, nurses, and phlebotomists collect a small amount of blood from the baby's heel for newborn bloodspot screening. These samples are then rushed overnight to the state public health laboratory for testing. Time is of the essence. Once the samples arrive in the laboratory, scientists make every minute count. On a typical day, over 300 samples are received and tested for over 45 conditions. Results are available within 24 hours. From 5 spots of blood collected on the newborn screening card, instruments punch a small amount of the blood into plates that will be used for each screening test. Some of the screening tests look at the banding patterns of hemoglobin to test for sickle cell disease. Some of the screening tests measure proteins to look for hypothyroidism, cystic fibrosis, or inborn errors of metabolism. Some of the screening tests look to identify newborns with spinal muscular atrophy or severe combined immune deficiency. All of these conditions have treatments that, when provided to the baby, can be life-saving. Here's a story about Maisie, a baby who had a disorder detected through newborn screening.
I'm Conrad.
I'm Leslie, and we have 3 kids, Theo, Ruby, and this is Maisie. And Maisie, on the 5th day of life, had an abnormal result from her newborn screening that led to a diagnosis of MCAD.
When we got a phone call from our pediatrician, he said that there was an abnormal result, and so immediately we were kind of thinking, well, that's really scary. What could this be?
A newborn screening saved us the trauma of one day walking in and her not waking up, or her having a metabolic crisis, or exhibiting symptoms of MCAD.
Her life would have been very, very different, and had there not been the newborn blood spot screening.
And you said this today, that she's one of one. There's only one Maisie. And I can't imagine our family without her. She's truly a gift from God, and I'm just so thankful that something like a little heel stick has given her such a shot at a healthy life.
When a screening test suggests that the baby is at high risk for one of these conditions, the program follow-up staff contact the baby's primary care provider and medical specialists. Together, these providers work to confirm the results of the newborn screen through additional testing and evaluation. If the presence of disease is confirmed, treatment is started. For the public servants of the Oregon State Laboratory, it's all in a day's work. But for the children whose disorders are caught and treated, the impact of newborn blood spot screening is measured not in days or weeks, but in a lifetime. In Oregon, it is mandated in state statute that all babies have access to newborn screening. Families, providers, policymakers, and advocates make sure that no baby is denied screening.